Hey guys, what's up? So this video is mainly focusing upon osteoarthritis. Osteoarthritis, guys, so it's mainly what involving the knee and the hip, right? So you would have obviously heard about your grandmother and grandfather. So those people would always be bothering you about the knee pain. So that is what they are suffering from. Osteoarthritis is the disease. Alright, so let's see why it happens and how to treat it. So this says that it's mainly due to wear and tear. Osteoarthritis is a group of degenerative disease, is a part of it, and it's mainly due to wear and tear, meaning your grandpa and grandma would have walked too much to get this particular disease. And there are two varieties, primary and secondary. The primary disease typically involves the hip joint and the knee joint. Apart from that, small joints can also be involved. But let's see the reason why these two joints are involved. So one thing which is common between the knee joint and the hip joint is that both of the joints are the weight-bearing joints, which is the most common risk factor for developing osteoarthritis as well. Typically, these people are old, so your grandpa and grandma has a hip pain and knee pain. It's mainly because of OA. And apart from that, too much of writing can also cause this disease. So too much of writing can cause pressure in the distal interphalangeal joints, and my favorite, TMT joint. TMT stands for the trapeziometacarpal joint of the thumb. So T is trapezio, M is metacarpal, and T is the thumb. So trapeziometacarpal joint of the thumb is also getting affected. Secondary causes include alcoholism, steroid intake, obesity, but other specific causes of any disease affecting the knee joint or the hip joint or any other joint for that matter, like osteoarthritis, can occur secondary to osteonecrosis or a previous history of fracture or trauma. Any secondary causes will cause secondary osteoarthritis. Pathology, if there's one slide I would like you to mug up, it's these. These are not very important from clinical point of view, but if you want to understand the pathology, these are very important. So there is fibrillation. Let's see one by one what fibrillation actually means, guys. So there's this articular cartilage. Let's assume it's in the shape of a square, and the sides of the square are approximately 5 centimeter. What happens in osteoarthritis is that the person constantly keeps using the same joint over and over again. Just like we use the soap, guys. We use the soap, we scrub our entire body daily. What happens is that the soap keeps going away. It keeps becoming smaller and smaller and smaller. At one point, it will vanish. Similarly, the articular cartilage, which is the main site, which is the main part of the joint which is affected, is going to vanish at the end, which is why it will start fibrillating the moment it starts thinning out. It will fibrillate just like the heart, and it will thin out completely. After the articular cartilage is gone, there's nothing separating the two ends of the bones, right? The femur and the tibia are directly in contact in case of the knee joint. The hip bone, the pelvis, and in the hip joint, the pelvis and also the femur are indirectly in contact with each other, which means there will be, it's like sharpening a pencil, guys. So there will be smoothening of the adjoining parts of the joint, such as for instance, it becomes smooth and glossy, to be very precise and specific. Hibernated appearance is what it is. And third is osteophytic spurs. So whenever there is a destruction, we want to grow more of the destroyed part, which is what the body is trying to do as well. So it is trying to form more bone. In that process, it is forming more osteophytic spur. Well, it usually occurs in the entire part of the joint, but what is the end product of it is that there's constant pressure. So the periphery alone, which does not have the pressure, is going to have the osteophytic growth, whereas the central part, which is in direct opposition with the edges with the part of the bone, does not have this particular osteophytic growth. And then subchondral cyst also occurs in a similar way. Synovial inflammation occurs following the osteoarthritis. There are some clinical features. The signs and the symptoms, of course, overlap because symptoms like pain, crepitus, swelling, stiffness locking are present. Plus, pain initially is going to be a dull aching pain, but it becomes crampy after some time. It starts with a mild pain, progresses to a severe pain, and it's usually seen after starting the activity and gets better when the person rests. Because we already know it is due to activity, right? And here we can see crepitus is because of this irregular joint, right? We already know these osteophytes are going to be formed. Plus, the surface of the joint is not going to be pretty smooth. It's going to be irregular. Even though the edges are glossy and smooth, the joint cavity as a whole is irregular because there is no cushion between the articular cartilage. So the bones rub against each other, during which sounds are produced. That is crepitus. There could be swelling, you can typically see it. It's mainly because of effusion and this inflammation. Specifically, if you want to know, the proteoglycans will drop and the water content will increase in this particular joint capsule area. There will be stiffness, which means the person will not be able to bend the knee or bend the hip or flex the hip. It's because of the pain and the spasm produced by the muscles, but in the later stages it is often attributed to the incongruity between the bones forming the joint, right? After that, there will be joint instability, and also locking of the joint is also pretty common. At the later stages of the disease, the person can end up with having a deformity such as a varus deformity, because the medial side of the knee is more often affected than the lateral side. Because guys, it's close to the midline, right? So there is where maximum tension, maximum weight bearing happens, which is why there is a tilt over here. So it's a varus deformity which occurs usually. On examination, we can see swelling attributed to effusion, and the joint as a whole is enlarged and it is pretty much deformed, right? After that, palpation. There is a lot of pain, specifically while palpating the joint line. There is tenderness on the joint line, along with crepitus and limited movements. After which we will do X-ray. An X-ray is usually detecting the osteoarthritis very simply. There are only two things which we have to look for in an X-ray of osteoarthritis. So you can see this X-ray, mainly the distal interphalangeal joints. So I want you to focus on all these parts alone in this particular X-ray. So over here, the joint space is reduced, right? Let me zoom in for you. So the joint space is very much reduced. See, this is the distal interphalangeal joint. The joint space is reduced. It's because of the inflammatory process. In addition to this, there will be gross deformity as well, as seen over here. See, the joint space is completely obliterated in the medial aspect of the knee joint. This is classical of osteoarthritis. Plus, this causes a varus deformity as well. Varus deformity slightly over here too. Other than that, you can see some subchondral cyst or any loose bodies. So what is basically loose bodies, guys? Any bone or a cartilage, if it is present loosely without any attachment to any main bone or a main cartilage, that is a loose body. This loose body is also often seen in osteoarthritis. So main thing is that we have to rule out three diseases which often mimic osteoarthritis and occur in the same age group as that of osteoarthritis. First one is rheumatoid arthritis. We rule it out by taking ESR and serology. Second one is loose body or frayed meniscus. We can do an arthroscopy to rule this out. Third one is gout. Uric acid levels can distinguish gout from OA. Course of the disease is going to be continuous. It is going to be progressing. No matter what happens, it is going to progress. It's like a clock with a battery in it. It is not going to stop. But however, we can take care at each and every stages. For example, the person has not developed any disease, any osteoarthritis, you can completely prevent it. For example, Indians have osteoarthritis of the knee very commonly because they have the habit of sitting cross-legged. Whereas in the United States and other countries where this practice is not followed, hip osteoarthritis is very common. So we prevent people from sitting cross-legged. We advise them to take a chair. We prevent the disease. Or sometimes we only have to alleviate the symptoms such as the pain or give rehabilitation for a deformity case. Treatment involves five things. First is drugs. Drugs include analgesics because there is too much pain. Second is counterprotective agents. Example of them include chondroitin sulfate and glucosamine. However, they are assumed to be very helpful, but they are not very helpful. There are no trials to confirm this. Viscose supplementation, supplementing sodium hyaluronate as an intra-articular injection. So this injection is given, it acts as the viscoelastic, it acts as the cartilage, and it gives some support. And then comes the supportive treatment. Supportive treatment will mainly target on the pathophysiology. See, the main problem here in osteoarthritis is weight bearing, right? So if you reduce the weight, there will be reduced weight bearing as well, which is why the supportive treatment aims at weight reduction, exercise, avoidance of stress. In addition to that, application of local heat can also help alleviate the pain and the swelling as well. And then surgery. Surgery is what we are main focused on here, right? So surgery includes osteotomy, meaning we basically break up the bone here and there and we fuse the portions of the bone. So if the knee joint is involved, we do this common thing, it's called a high tibial osteotomy, meaning it's taking place mainly in the highest part of the tibia, which is why it's called a high tibial osteotomy. Whereas for the hip, we do something called this the intertrochanteric osteotomy, meaning between the greater and the lesser trochanters, we break up the bone and we realign them in order to control the deformity as well. Apart from that, joint replacement can also be done. Artificial joints can be replaced, and this is going to be helpful for a period of at least 10 to 15 years, which is so good. And then comes the joint debridement. No one knows if this is actually working or not. See, what happens here is that we are debriding the joint, but technically, debriding will worsen the disease, which is why this treatment is not very helpful because we don't know what the outcome is going to be. However, it's one of the treatments which can be preferred. Arthroscopy. Arthroscopy is done this way. We remove any sort of a subchondral cyst or any loose bodies, a bone or a cartilage, or any other osteophyte formation could be detected and removed as well. And that is how osteoarthritis is treated. So in this video, we saw a lot of changes which happen in osteoarthritis about the wear and tear and the types of it, the primary and the secondary types. We saw those five pathological features, clinical features, and also how to diagnose it by means of x-ray, by seeing the joint space and the deformity, and the treatment, and various surgeries. Well, with this, I can conclude. See you soon.